Good afternoon, everyone. Today you're here with me, Mikel and Yineri Enumbi, and my friend.
Satrio Sulthoni Ardhiasa, and you can call me Rio.
Today we will be presenting our journal review using the IMRAD+C method, which stands for Introduction, Methodology, Results and Discussion, and Conclusion. As of the article itself, the title is The Right Scan for the Right Patient at the Right Time, the reorganization of major trauma service provision in England and its implications for radiologists. So without further waiting, my friend will start.
Okay, so here are the table of contents. The first one will be introduction, methods, results, discussions, and we will end it with conclusion. So the first one is introduction. We're going to start with the background of this journal. So trauma is the leading cause of death in individuals under 45 years old, particularly affecting young people. It results in a significant loss of life years, with its death accounting for about 36 years lost. In addition of mortality, many survivors suffer permanent disabilities, and trauma also creates a substantial economic burden, costing around 4 billion euro annually in England. The second one is research objectives. So the first point is to explain the rationale for establishing regional trauma networks and major trauma centers or MTCs in England to improve trauma care. Second one is to examine the role of radiology in the new trauma care system, particularly in providing rapid imaging for trauma patients. Third is to highlight the standards for major trauma imaging set by the Royal College of Radiologists, including the use of whole body CT or WBCT. Fourth is to address radiologist concerns about the inappropriate use of WBCT, radiation exposure, and the risk of intravenous contrast media. And the last one is to discuss methods to improve whole body CT reporting in trauma patients, such as standardized reporting, dual radiologist review, and urgent injury severity grading. The second one is method. So the article is a review study that synthesizes existing evidence, clinical guidelines, and observational research rather than conducting experimental research. So it examines the rationale for trauma networks and discusses new trauma imaging standards issued by the Royal College of Radiologists. And the evidence used in the review comes from various sources, including epidemiological data, national healthcare reports, large patient datasets, prospective studies, and trauma registry analysis. And by integrating these sources, the authors analyze the function of trauma networks, the role of imaging in trauma care, and the implications of radiology services in a reorganized trauma system.
Then for the results and discussions. So in accordance to the research objectives already mentioned, the results and discussions are as followed. First, the rationale behind the setup of MTCs or major trauma centers is first inspired by two countries with MTCs that presented with higher mortality rates and better patient outcomes, and that is the USA and Australia. Then when applied to the UK, this proved to have worked similarly. MTCs also provide a 24/7 consultant-led service for the management of traumatic injuries. And other traumatic units will have to refer patients to MTCs. And although there was a consideration for time and urgency, it is proved that getting patients somewhere where emergency service is guaranteed is so much better than just getting them to the nearest hospital. And all of this will contribute to increased quality of service, and therefore more trauma patients will be managed within the best hands. And the proof is as highlighted in the pictures. And then next. The second point is that the main role of radiology in whole body CT scans is to provide 24/7 access to whole body computed tomography with expert image interpretation, and to provide 24/7 access to interventional radiology services, primarily for emergency hemorrhage control. And this can be regulated through the 18 standards required for trauma imaging service provision in the UK that is set by the Royal College of Radiologists. And these standards include sufficient and appropriately trained staffing, quality infrastructures such as CT machines, angiography suits, MRI machines, and etc. The effective usage of non-invasive and non-operative radiology procedures such as interventional radiology, and then the correct procedure and usage of whole body CT scans. Then for the fourth point, considering some adverse effects of frequent WBCT usage, such as radiation or risks regarding the contrast media, there are specific indications of when whole body CT scans should be used. And this was summarized in a plot, as you can see in the right side. So A for high risk mechanism of injury, and the details you can read, and B for any anatomical findings, and C for any physiological findings. And as for the fifth point, regarding specific and detailed reports of radiology cases and results, there is a proposal for several layers of review and clinical assessments from radiologists. And all of this is done to ensure a unified and specified reports and ease the burden of mistake from just one person. So in conclusion, overall, the article highlights the major development in emergency radiology in England since 2012, and particularly the establishment of regional 24/7 trauma imaging and interventional radiology services aimed at improving previously inconsistent out-of-hours care. And it also discusses the ongoing challenge of appropriately triaging patients for whole body CT scans and balancing the benefits of rapid comprehensive assessment with concerns about radiation exposure and over-reliance on imaging. The authors also emphasized the important role of radiologists in guiding the trauma team on the proper use of whole body CT scans and interventional radiology. In addition, this article also notes the complexity of WBCT interpretation and suggests that standardized reporting systems, consistent terminology, and dual reporting may help reduce misdiagnosis and improve interdisciplinary communication. This was an incredibly insightful read for our team, and especially in the context of us being medical students. And using IMRAD as an analyzing tool also helped us to see the main ideas and read this article in a structured format. And that is all that we can share with you guys today. Do you have anything to add, maybe, Rio?
No.
Okay, thank you for your attention.